Great. Hello, everyone, and welcome to our Understanding Ableism webinar series hosted by the King County Disability Consortium and the Disability Empowerment Center. My name is Sarah Marshall. My pronouns are she, her, and I am an AmeriCorps member serving at the Disability Empowerment Center as the KCDC coordinator. I am a young white woman in my 20s. I have short brown hair, and I'm wearing a white button-up top and an orange tank top today. So before we get started, I'd like to go over a couple accessibility things. For all of our participants, captions are available in Zoom. You can click the show captions in your Zoom menu bar to turn them on, and they are also running at captionviewer.net. The URL is too long to read, but I'm going to ask Cart to put that in the chat. And if you'd like to access it, you can click the link and follow it through there. We also have ASL interpreters available today. You're presenting in gallery view, so the interpreters should always be visible. You do not need to pin them. Please know that we have 2 interpreters, so if you pin the current interpreter, it could prevent you from seeing the active interpreter after an interpreter change. You do not need to be on Zoom to access this event. We will read all questions out loud and voice any images on the screen so that the content will be available to individuals calling in on the phone or whoever cannot see visual content. Please know that this event is being recorded and will be published to the Disability Empowerment Center's YouTube channel after it ends. And then later, after we've addressed our questions to our panelists, we will have a Q&A portion. We ask that if you have any questions, you use the Q&A tab at the bottom of your toolbar to submit those to our panelists. And then we will read them out loud and our panelists can answer at will. And then finally, we will use both person with disability and disabled person interchangeably throughout, recognizing that different people have different preferences for person first or identity first language. And so with that, I would like to give a short definition about ableism. Okay, I see Jim. Let's see. Should have ASL. Apologies, really quick. We're just going to make sure that ASL is accessible for everyone.
When you're showing your screen, this is the interpreter. Sometimes the deaf participant can't see unless we're spotlighted or they can pin us.
Let's see. Jim, if I have it side by side, are you able to view?
The interpreter's going to pin. 1 second. And I can't pin him. And I'm not seeing him here inside the room. So is everyone's, this is the interpreter, is everyone still in the waiting room and they can just hear you? Oh, he said good now. Okay.
Great. Then we'll go ahead and get started. So, disability researcher Ian Langtree defines ableism as a complex system of beliefs, practices, and institutional structures that position disability as inherently negative while simultaneously privileging non-disabled bodies and minds as the standard against which all others are measured. And so with this
Sarah, I apologize. Can you go back to the beginning of the definition?
Yes, I'll read it one more time. Disability researcher Ian Langtree defines ableism as a complex system of beliefs, practices, and institutional structures that position disability as inherently negative while simultaneously privileging non-disabled bodies and minds as the standard against which all others are measured. With this definition in mind, the Understanding Ableism series was created to explore how ableism shows up in our policies, communities, and everyday interactions. And each session brings together community members and advocates to share lived experiences and practical knowledge with the hope of helping us all move towards a more inclusive and accessible King County. KCDC began during the COVID-19 pandemic as a way to connect disability-serving organizations and community members during a time of widespread isolation and uncertainty. Many people with disabilities face disproportionate barriers, and KCDC was built to share information and elevate lived experiences to respond to the needs of our disability community. For today's webinar, we will be discussing medications and access. Medications can play an important role in supporting health, independence, and quality of life, but access is not always straightforward. Many barriers exist and can greatly influence whether people are able to obtain and maintain the medications they need. Throughout today's conversation, our panelists will share both professional and lived perspectives on these issues, helping us better understand the challenges, complexities, and opportunities surrounding medications and healthcare access. I'm glad you're here, and we look forward to a thoughtful discussion. So now I'm going to have our panelists introduce themselves with a name, pronouns, short visual description, and then their role or occupation as it pertains to the webinar.
Hi, my name is Hannah Glover. I'm the health navigator over at the Elizabeth Gregory home. My pronouns are she, her. For visual description, I'm a white woman in my mid-20s with blonde hair. Yeah.
Hello, everyone. It's so great to be here. My name is Olivia McCollum, and my pronouns are she, her. I am a mid-20s blonde white woman, and I'm wearing a white shirt today. I am a,
Olivia, I
yes,
apologize. This is the interpreter.
yes.
Whoever's spotlighting the speaker, it takes away the interpreter on the screen. So if the
Okay,
interpreters need to be spotlighted, with the speakers, you would just have to add instead of replace. So can you start over, please? Thank you.
yes,
Okay,
of course.
1 second. Okay. Okay, so I just added spotlight, so there's two of us. Whoever is doing spotlighting, if you can add um, and not do the replace, then our participant can see the signs. Thank you so much.
Wonderful. Thank you. My name is Olivia McCollum. My pronouns are she, her. I am a mid-20s white woman with blonde hair, and I'm wearing a white top today. My role and occupation, I am a third year PhD student in the Department of Epidemiology at the University of Washington. I also have my master's degree in public health and epidemiology as well. And I work in a variety of different areas, but I'm excited to share some of my disability research with all of you today as not just a disability researcher, but as a person with a disability as well. So thank you very much for having me.
Cynthia, I'm not able to hear you. I'm having some issues with your audio. Okay, I think Cynthia's doing some technological troubleshooting. We'll give her just a minute to try and rejoin and then move on. Okay, I'm not seeing her join, so we'll transition to the first question and then I'll go troubleshoot with her. So I'll have Hannah answer first and then Olivia. But for our first question, how has your understanding of medications and healthcare access been shaped by your lived or personal experience or professional experience, excuse me?
Absolutely. I mean, this is such a big question. So for me personally, I am the child of someone with a disability. So I've just kind of experienced that for a large portion of my life, both as a helper to a parent and then just, someone watching it all go by. But for my professional experience, so in my role, I'm a healthcare navigator at a drop in day center. Um, the drop-in day center I work at, the Elizabeth Gregory home. We mainly work with people who are experiencing homelessness or are unstably housed. So a big lens that I view disability from, just from that lived experience, from my work, is through homelessness, which will kind of you'll see in my answers to a lot of these other questions. But of course, I understand that it is not a monolith, and there are many ways that people live with a disability. But that's my understanding of it and kind of the experiences that I'll be talking about today.
I will go ahead next. So I think this question is really important, and I was thinking about how to respond to it prior to this webinar, and I have both a personal and professional experience with this. So I identify as a person with an invisible disability. So outwardly, I don't present to the world as someone who may be easily seen as someone who's disabled. But I understand the experiences of those who have disabilities, specifically those that are not visible outwardly. And I think it can be very hard to feel safe in healthcare settings, and also when accessing medication. It can be really challenging to find providers, not only just providers at a clinic, but also pharmacists and people who work in medication administration and dispersion. And so I think that it can be quite difficult to communicate with them in a way that feels safe for me. And so I empathize and understand that in a lot of ways. And I think from the professional side, I do work with individuals who have violently acquired spinal cord injuries. So people who have had experiences that were very traumatic and now are living with a permanent disability. And in my research, we also consistently see how access to medication and healthcare is disproportionately challenging for disabled individuals, and we can see that from both the research side, and I've also seen it in my own personal experience as well. Um, and so I think that there's a lot to talk about that we'll get into later in these questions, but that's where my lived experience comes into play with this, and as well as some of my research experience too.
Cynthia, do you want to go ahead?
My name is, can you hear me okay?
Yeah, we can hear you just fine.
My name is Cynthia Coffin. My pronouns is she, her, hers. And I'm the program coordinator at Disability Empowerment Center. And the answer to the question is, with medication, it is sometimes getting access to medication can be challenging um, because of lack of prior authorization, having to wait on my doctors. And I really had to advocate myself over the past even year to get access to my glucose monitor. And it's been good to keep up with the advocacy too. And I do have a lot of lived experience in the healthcare setting. Um, and I've definitely um, am a big advocate in providing better healthcare services for people with disabilities.
Thanks for your response to our first question, panelists. I think medication, as even just a definition, is a very broad and all-encompassing term. And it's something that I would say almost everyone has some sort of contact with, whether you're taking medications or not, whether you're taking things temporarily or not. But it is an issue that affects us all. So it's very good to sort of consider the ways in which we interact in our own healthcare systems. So let's move on to our next question. How do issues like cost, insurance, transportation, housing, or language access, and I'm going to add a little disclaimer here, just anything, any sort of issues that you as panelists have seen personally or otherwise, how do those impact people's ability to consistently access medications?
This is such a great question and such an important question. The phrasing of it is excellent with the consistently access medication. Also, this is Hannah speaking. Because you can't consistently access medication unless you are meeting every single one of these topics with your medication. If it costs too much, you may have to make decisions on what's important to spend. And if your medication is the most important thing to you, you may go without other things that are essential needs. Having access to insurance, that may alleviate some of the costs, but you may not be able to pay the monthly fees. And if you're on Medicaid and you don't have to deal with these costs, transportation, housing, language access all makes a huge difference. If you have a disability where it makes it really difficult to get to the pharmacy, then you have to put into another cost thing of having medication delivered. It's really just such a multifaceted issue. And the big part about ableism is people aren't thinking about it. They're thinking, well, I just pop down, to the pharmacy after work and I pick up my medication and I can speak to everyone there, and I hand them my insurance card and pay my copay and it's easy for me. So like, why is this such a big deal? When they're not realizing that if you just take one thing away, it can make it incredibly difficult to access these resources. From my professional experience, a lot of the people I work with are in house, so they're moving around a lot, and so that consistent pharmacy just doesn't really exist, because an area that might be really easy for them to get to one day is absolutely not an easy accessible place the next. And then on top of that, if they are staying outside and they're items get stolen, or even in shelters, items get stolen all the time, they're really losing out on their ability to get their medication because they just don't have it. And then they have to go to their provider and get a new prescription. And if it's a controlled substance, that's another, trial. So just being able to treat or be at a basic level of maintenance with a disability is way more challenging, than people assume, because you have all of these roadblocks that keep on appearing, and that can change on the daily. which is really important to understand when we're talking about medication. And I know we'll get into it more in later questions, but having people who can access the system if you don't have to, who have the ability to go somewhere, who can speak the language, can possibly help with the financial constraints, makes such a big difference. It's just something that's really hard, and there's no easy solution, and that's, I think, why we're all here today talking about it, is trying to break down what the challenges are and how we can best address them.
This is Olivia. Um, I think this question is really, really fantastic and very important. And a lot of my response today is going to be quite similar to what Hannah said. Um, but, accessible care and access to medication with consistency really does involve so much more than just having an appropriate translation service or having materials in your preferred language, or living in an area that has appropriate public transit that's also accessible, or other kinds of paratransit options. It's also about having the knowledge and understanding of a system that is built and was developed through an ableist lens. And so really seeing that this is not something the system was not built for people with disabilities, despite being something that people with disabilities need to rely on in a lot of ways. And medication access is an insanely big issue for people with disabilities, and even for those with insurance, copays are very, very high. Home delivery options are only helpful if you have a place where you can get that medication delivered. They also are more expensive, and there are lots and lots of medications, including some of the medications that I personally take, that are not available for home delivery. You have to go in person to pick them up. And sometimes you need even your identification with you to pick up those medications. And when you think about all of these steps that go into getting medication from a pharmacy, or from anywhere, but specifically in this example, a pharmacy, as opposed to someone who may just be able to go and pick it up in 15 minutes and really quick grocery run, basically. This could turn into a 3-day coordination for people to be able to find the transportation they need, find a place to get things delivered if they need that. Being able to make sure their insurance is up to date, that they have identification. There's just so many barriers that come into play when you start thinking about all the different things that people are dealing with when they're trying to get these medications, and especially the burden that disabled people disproportionately feel. And so I think that and additionally, translation and language services are hard to find. More and more pharmacies are either going out of business or changing, and being able to find things that are in stock as well. I know personally, a lot of my medication has to be pre-ordered and things like that. And so when it's out of stock, I am left with nothing. And that is not okay. And it's not safe for a lot of people as well, depending on the kinds of medications that they take. And so I think that this is an entire section of public health we could talk about for hours, but I think that those specific things that Sarah has in this question here for us are really, really important to consider. And they make a huge difference to patients as well. When they do have access to those options, it can make it much easier and much more straightforward for them. And so really making sure that not just our clinics and hospitals, but our pharmacies are well equipped to support people with disabilities is really important. And so I'm looking forward to talking about this more today with you, and hearing what the other panelists think. So thank you.
I think this is a great question. It definitely for me anyway, the biggest barrier to medication is cost and having to pay for it. And with the rising cost of rent and the impact of other things I do have to cover. And basically, again, it that's one of the things I experienced and having to advocate to the pharmacy that I have two insurances on file, and getting that through has been a challenge. But going back to what the past two panelists have said, the impact on housing and language and accessing medication. Some people do have to decide either to pay rent or get their medication, and it could be challenging. But I think also providing people resources to help navigate um, insurance and would definitely be a good aspect to help people get their medication. Um, and yeah, I've definitely, every time I've gone to a pharmacy, I have tried to navigate that process to get my medication as low cost as possible.
Thank you for your responses. Yeah, I think, going into it, it is a very big issue, and there are a lot of interactive aspects of the process of accessing medication. I mean, even just getting the prescription from a doctor in the first place, you have to somehow prove that you are impaired enough to need some sort of intervention, which I think is in of itself a challenge or a barrier. I also want to highlight just this is something that your responses made me think of, was just sort of the way in which corporate healthcare structures act, especially in comparison to different ways in which healthcare structures function in different countries. I think for a lot of people, the United States healthcare system is all we've known, it's all we've interacted with. And I think it is fair to say that it does fail a lot of people. A lot of people are not able to get what they need, even if, the cost of manufacturing and distributing these different products is negligible compared to, the impact that it has on people's lives. You look at different countries that are more willing to put money and funding and government support through social welfare systems, and I think you see that trickle down in the ways in which people are able to access medication. So, not to go off on a tangent there, but I think, cost and the way in which that burden is allocated is something difficult to unpack, but important to consider. So for our next question, what resources or support systems have you found most helpful while navigating medication or healthcare barriers?
So this is Hannah speaking. This question is really the whole existence of what my role is at the Elizabeth Gregory Home. So as a health navigator, my job is to bridge the gaps for people in whatever healthcare means for them. And so part of that, solution is just having someone who knows the system, who does not have the stress of emotional involvement and their health involved in it, who, can speak on the phone to someone to try to sort things out, if there's an issue with medication or prescriptions, who, knows providers in the area who are understanding of disability and the constellation of things that go with that. What I find is really helpful for a lot of people is, even if this isn't your job, even if this isn't, something that you're doing day to day, you still exist in a community. You still know people with disabilities. And so offering help whenever you can you know, it's exhausting to ask for help. It's exhausting to constantly be needing assistance in order to exist in your life. And so taking away that mental load and that mental burden, um, of needing to sort out who can help you with things, like we were talking about earlier, if you have a friend who, or a neighbor or someone who you can pick something up for them, at the pharmacy, or you can run some errands for them, making sure that you are not just looking out for, your, in my case, my job, but I'm looking out for my broader community is really impactful. Because unfortunately we are working within a system, as everyone who said, that is not meant, for people with disabilities and is not set up in a way that's successful for them. So, trying to game the system with whatever ways possible is really important. I'm trying to think of some tangible real world experiences. There's some great providers in the area who specialize in working with people with disabilities and are really understanding about these things. So things like lost medication, or having, not being able to pick up medication within a certain time frame, or needing their medication to be packaged or, processed in a different way. Having people in your corner makes a huge difference. And that is not the responsibility of the person with the disability. It is the responsibility of all of us and everyone in the community to make sure that we are in people's corners and we are looking out for them.
This is Olivia. I completely agree with what Hannah said, and I think that so much of what she just said is so important, and having someone who can support you. Um, for me personally, one of the most important things for my experience has been educating myself on on how to access my resources. Knowing how my insurance works and familiarizing myself with what I should expect when I go to pick up my medications at the pharmacy or go to an appointment. And having that knowledge of what is expected of myself, my provider, and my pharmacist, it really can help me better navigate that system. That all comes with the caveat that that is a luxury, to be able to sit down and take that time to get those resources put together and understand them. And so that is not possible for everybody. And in that case, then I would, of course, suggest something similar, that, to what Hannah was speaking about having someone who can take on that responsibility in a way that can support people who may not have capacity for that. And oftentimes most people don't. And as someone who works in the field of public health, I have a privilege that I have some of this education and knowledge to make it a little bit easier on myself. But one of the ways that I also try to support is by doing some of that for some of my friends and people in my life who are also disabled, and sitting down with them and going through those pieces of paperwork and trying to figure out how best to get them the care and resources that they need. And so that person can be somebody at a center or an organization. But if that's not possible, sometimes even just friends and family, people in your life can help with that. And of course, as we discussed in some of the previous questions, having the ability to get access to providers and organizations that are disability friendly, and that will provide resources to folks with disabilities in a way that is equitable, kind, and compassionate. And I think that that's really important. So I would say, personally, my educating myself on my resources, but leaning on others for support as well has been incredibly helpful, and is something that I've also seen in the research that I do with disabled individuals, and their need for support from their family, friends, and resource navigators at the centers and organizations that they receive services from. So I think it really depends on the person, but those are some of the resources that I've used and people I've spoken to in the disability community have also used as well.
I say for me, the biggest help navigating is through the system is just I've done a lot of it myself because I have experience just navigating the process of keeping up with my doctor's appointments and keeping up with my medication, but I also receive help from friends and family. I'm currently receiving help from a friend of mine on a specific issue, and relying on other programs to help resource health navigators in different organizations is a great process to go through. But in my own experience, I've had to really sit down and go through um, the process of navigating, even as far as two different insurances, what doctor takes this, my primary insurance, what doctor takes my secondary insurance, and having to do a lot of research on that. And it does take up a lot of time, but I'm still learning, even in the process of doing this. Every day I'm learning something new that I didn't know this was the case. um, and even navigating through Medicaid and the private insurance I have, I definitely um, have learned a lot over the past few years.
Yeah, thanks for your thoughts. I think to all your points, it can be a process of trial and error, of just figuring out what works for you, and getting to know what you need. Uh, Two resources I'd like to highlight. First, in Washington, if you are making a certain level of income, I don't know the number off the top of my head. I think it's around 1,800. But if you're making 1,800 a month or less, you do qualify for Washington Medicaid Apple Health, and that is completely free. So they do cover essentially all the costs of healthcare for you. So if that is something, I mean, I'm on Apple Health myself, and it is the only way in which I can pay for any of my medications. So something to consider. And then the other resource I've found in my personal experience that I find really helpful is if you are connected to a community of people who have a similar disability to you, whether that's, in person, online, oftentimes, people are trying different things and are communicating about it. So I have friends, I have people I've worked with in the past who have shared resources with me that I was unfamiliar with that are specifically geared towards me and my disability. So it's good to turn to your peers, especially when they themselves are having to navigate the system. So with that, we'll move on to our final question, which is, what would a more accessible, supportive, and person-centered approach to medications and healthcare look like?
This is Hannah speaking. This is one of those questions where I cannot give you the answer. I'm not a person with a disability, and so I should not be dictating how we, develop a new system. I have some suggestions, but at the end of the day, what I think is correct about this, means very little in comparison to the people who have to navigate the system and have to exist within it. So I think the first start is absolutely, asking people with disabilities, seeing what can be done. If you're a member of an organization and you're able to make change with that organization, asking the people you work with or for, or, in collaboration with, what can be changed. I know that at our day center, we try to do that frequently, whether that's, letting people know if adjustments in lighting need to be made. We recently finally were able to get a ramp put into the space, and just trying to understand what we don't know and what are ways to make things more accessible for people, and that they might be things that we never think of or would not think made a huge difference in someone's lives, but really do. Um, you know, when it comes to medication, I personally am a firm believer that, healthcare should be paid for by the government and be widely accessible to everyone. I think that's a great start. If we have people who need to stop worrying about how much their medication is going to cost and how much, how they have to budget it and make sense of it in their life, and just have it be, something that people are entitled to as they should be. I think that will make a huge difference. Um, but yeah, I think following the lead of people who are most affected by it is always going to be something that's the best way forward.
This is Olivia. I think this question is really interesting in that this is something that public health has been trying to solve for a long time. I think that this is a question that is not easily answered. But I'd like to bring in a takeaway from a study that I'm working on with one of my mentors at UW, where we are at the University of Washington, I'm sorry, which looks at rehabilitation and post-injury experiences of spinal cord injury patients and survivors of abuse that have that had a spinal cord injury as a result of that. One of the biggest things that we heard from participants, this was a qualitative study, so it included interviews that I analyzed and interpreted for the study. And one of the things that was really apparent was the way that the best care happens when providers understand that patients with disabilities are oftentimes experts in a lot of the experiences that they have, if not all of them. Especially if someone has been living with their disability for a very long time, there are so many nuances to that disability and experience that providers just do not understand. They may understand the medical side of it, but there are lots of even medical things, like physical things, that they may not 100% understand. And certainly the emotional and social impact of having a disability is very, very impactful on the experiences of individuals. And so when seeking out care, and that doesn't even need to necessarily be somebody who you're sitting in an office with talking to. It could be your pharmacist, it could be a nurse, it could be the phlebotomist, even when you go in to get your blood drawn, it could be your dentist, anybody who you see for care. They need to also understand that that people with disabilities are oftentimes the expert in their disability, and they may not be able to make the same kinds of decisions in medical choices as a provider would, but that provider should be asking questions that help them understand the experience of the disabled individual or person living with that disability. And so from our participants in that study and from my own personal experience, it means so much when a provider asks the patient questions instead of just telling them that this is how it needs to be or this is what will be best. And I think that's really where that supportive piece and that person-centered approach comes in, is that if we aren't if we aren't listening to people with disabilities and their experiences, the care that we provide to them is not going to be appropriate. And so for me, I think the first thing I think of is listening, and not just listening, but using the experiences that are spoken to the provider, using that information to make decisions that are in the best interest of disabled individuals. And so that can look a bunch of different ways, but making sure that pamphlets and instructions and resources are available in the appropriate languages, and that those who may need support with insurance and all those resources we just talked about previously are able to get those. And so I think that there's a million different things we could talk about in terms of this question, but that listening piece has been very influential for me and for the individuals that I've spoken to in my research. And that does not mean it's always the case for everybody, but it is just a trend and something I've seen personally and professionally.
This is a great question. I think for me, what person-centered means is a doctor listening to my concerns, and like what the previous speaker said, just listening and being um, authentic with the person with a disability and taking their concerns into consideration. Um, Another aspect is having, for insurance purposes, having an outside advocacy group that can help advocate on your behalf if you have issues with your doctor or issues with getting medications paid for. Medicare has just launched a program called Solace, and their primary job is to help you advocate to your doctors about getting medications approved. If insurance with denial claims, they can help you with that. They can help you find doctors, primary care in your area. And I think it'd be ideal if all insurances have this program. But in my own experience, I definitely advocated, kept having to retell my story over again to new doctors and just trying to get everybody on board with my care. One of the past experience I've had is working with mainstream medicine and alternative care, and trying to get them both two on board with my with my medical decisions. So that in itself has been a challenge in the past. So I think person-centered care is definitely a good way to go. And one thing I've learned, we have to advocate for ourselves and let the doctors know what we need and tell them everything about all of our concerns.
This is Sarah. Thank you so much for all your thoughtful reflections. I think you all touched on a very important point, which is that it definitely has to be collaborative. Can't be a top-down sort of thing. It has to be people wanting to work together for the betterment of us all. Okay, so with that, we're going to shift into our audience questions. We invite our audience members to submit any questions they may have for our panelists using the Zoom Q&A feature. For those unfamiliar with this, you can find the Q&A tab at the bottom of your little toolbar. It should be on the bottom right next to the More, and it's a little icon with a question mark in it. So you can type your question, press send. It will be visible to everyone on the webinar, and I will read the questions out loud. Our panelists are welcome to respond to any question and do not need to answer in the same order as earlier. Just feel free to jump in whenever you'd like. We'll take as many questions as time allows. And just as people are formulating questions and typing, I'll address a question to our panelists. So I'll ask you all this question. How can people navigate situations where they feel pressured into or discouraged from certain medications? Maybe going back to earlier points about how sometimes it feels like medical professionals are telling you to do a certain thing.
Sarah, would you like us to go in the order previously, or would you like us to just pop in if we have an
Go ahead
answer?
and just pop in. Whoever wants to answer the question can, yeah. And,
Okay,
multiple responses, totally welcome, for sure.
great. I have a somewhat answer for this. I don't think it's perfect, but when I saw this question the first time, my instinct, of course, from a perspective of having to navigate hospitals and care providers for a long time, my first instinct was a second opinion, and I think that's what a lot of people will suggest, is that, if you're feeling like this provider isn't working for you, just go and find a different one. And unfortunately, I just don't think that that's a fair thing to ask people to do, because finding a provider can be an absolute nightmare, which I'm sure even folks who aren't living with a disability know that that getting a provider that's in your network that you can access, and that you trust and feel comfortable with, it's like a mile-long checklist. And when you find someone who fits into at least a little bit of that, it can be like, okay, I just can't lose you, and so when you're in a situation where providers are making you feel as if you need to take a specific medication, or you need to not take this or take that, it can be hard because they're, of course, in a position of power in that discussion, even though that shouldn't be the case. There's social norms and things like that we do encounter, and so being able to get a second opinion would, of course, be the best option, but that's just not possible for lots of people. And so one of the things that I've found in my professional and personal experiences, really having to advocate for yourself, and that can mean a lot of different things. That can mean personally, like in your appointment, telling your provider that your experience matters and that you're not feeling comfortable with the medication options provided to you or the care options that are provided to you. That is also something that can be very challenging. And so another option can be bringing a trusted friend, family member, or coordinator from whoever feels the most comfortable and trusted for you, and bringing them to appointments and calls and things with providers can be helpful in giving you that resource to kind of feel comfortable saying to the provider, I'm not okay with the options that I've been given. And I think it's really important to remember that you and all of us deserve to have a provider that listens and learns from you about your experience, because that is so important. And so that's just what I would say is, not being able to get a second opinion is very common. And so sometimes trying to navigate what you have existing can be helpful.
If any of our panelists want to go ahead and address that question, feel free.
Absolutely. Olivia, this is Hannah speaking. Olivia brought up really good points on, not putting the burden on yourself, and, deserving to trust a provider. I think another thing that people should remember is you do have avenues to report providers who have made you feel unsafe or have made you feel uncomfortable, or even that you think are misinformed about something. We have built up the healthcare system in the United States to be this, grand pedestal where, the doctors are on top and we all just have to, listen to their guidance and worship them. But they can make mistakes and they can be misinformed and they can just be plain wrong sometimes. And if you feel unsafe, there are usually ways to communicate through the hospital, through insurance, through things like that, to express your concern or worry, about certain medications being offered if you feel that they're unsafe or not being, given out responsibly. I know that that is another thing to put on your lap and is not something that you have to do. But if people feel that they have the bandwidth to do that, I think it's always a great thing to both advocate for yourself, because usually through that advocacy you end up protecting other people as well from an uncomfortable situation.
This is Cynthia speaking. I'd say going back to what the speaker said earlier is getting someone to go with you is a good idea. Switching even a second opinion is a good idea, but sometimes that may not work. And just navigating and seeing what other people experiences have been like with similar doctors, or I've always gone online and read reviews about primary care before switching doctors and providers, so and that has helped me. And then just really advocating for myself, and then even as far as choosing not to take a medication, I I've done that and said no, I've decided not to do this. And in the past, I've even sought out alternative health providers for help. So there's a lot of different avenues.
Thanks for your thoughts. I would like to ask a question from one of our audience members. Tia, thanks for asking. Have you seen any changes in the ways medicine or medical help has become more or less difficult to access post-COVID?
Yes, this is Hannah speaking. That is a huge one. I think, especially when it comes to behavioral health care. Um, a lot of providers have exclusively done telehealth now, which is not accessible for everyone. As we've seen, even in this, meeting, there's been technical difficulties, and are in some cases not even accepting insurance anymore, because whatever payout structure has gotten so much worse. So that's been pretty awful. I know some people have benefited from telehealth, but I think there's a huge portion of the population that overlooks, and favoring it more than other things has made it really hard. There's also just a shortage of providers in general. I think burnout and trauma from the pandemic and being, a medical provider during the pandemic, caused a lot of people to shift what they're doing in their profession. So people that you can go to for primary care or, day-to-day care has, there's been a huge exodus. So unfortunately, I think we are looking at a worse environment since the pandemic, and a worse environment for everyone in accessing medical care, which of course makes it worse for people who have more acute needs. So if anyone's at all interested in healthcare or joining the healthcare industry, I highly recommend people with empathy and interest in this topic become ingratiated into the system, so that they can work towards fixing it.
This is Cynthia speaking. I've noticed it's taking a lot longer to get into primary care first time primary care, and then it's taking several months to get into a specialty doctor. It can take upwards of at least 3 months to get in. So I've noticed even before the pandemic, it took around a few weeks to get in. So again, reiterate, less providers have been that's in contribute, and then less. And another challenging too is less people are going in to medical school, and medical schools only accept so many students. And then another challenge is the in the field is that with residency, there's only so many residency spots across the nation each year. So that's another challenge. since the pandemic.
This is Olivia. I just want to echo both what Cynthia and Hannah said. I don't have a whole lot to add, but I just wanted to say that I think that those observations are very relevant and like I especially with the medical student piece, not being able to get enough providers is a huge issue. And there's a lot of barriers to entry for that. And so I think that really being able to get people the providers that they need, but also giving opportunity for those who are interested in the field to be able to actually do that would be so helpful for everybody involved. And so I think that that's just something that I wanted to also highlight. And thank you, Cynthia, so much for bringing that up.
Hey, I'm not seeing any other, sorry, this is Sarah. I'm not seeing any other questions right now, so I'll ask one more since we still have some time. And I will paste this in the chat as well. How do medication shortages, insurance denials, or prior authorization requirements disproportionately impact disabled communities?
Quite a bit of personal experience with this situation. So I'm happy to help. Oh, and this is Olivia, by the way. Um, so I think that people with disabilities are more likely to, have medications that require more prior authorizations, may have, more less common medications that they take, and so and also have things like controlled substances, things that are controlled drugs that are set under certain classifications, and so you have to bring your identification in when you go and pick it up, and you can't do any home delivery things and things like that, and so when you are navigating this as a person with a disability in a system that was not designed for you, and not designed for people with disabilities, quite frankly, at all, the shortages and the denials and the authorizations can take anywhere from like a couple days to weeks or months. And, um, you know, people are prescribed medication by their provider because they need that medication, right? And so when you are sat there, calling your provider and saying, "Hey, I really need this, to be filled. I need my medication. I'm about to be out, and I can only get it at a certain time." And then all of a sudden you have 2 weeks of prior auths, and you have insurance denials and shortages. Then there's all of that time between the prescription and the actual, getting the medication. And this set of time between that can be really, really impactful, and it can be dangerous in certain situations, right? Like depending on the kinds of medication you're on, you know, a week may be way too long to wait before you can get a refill. And so the time that disabled people lose in between those things adds up. And, especially for people with disabilities who are often those who need those medications as, soon and in a timely manner because of their disabilities and their needs, that is a disproportionate and directed um, it's a disproportionate and directed attack on disabled individuals. And it doesn't need to be intentional for it to be impactful on people. So even though the pharmacist isn't trying to take 2 weeks, it's like, well, the system was designed so that it's not prioritizing people who need things immediately or within a very specific time range or time frame. And so the ableist structure of healthcare and pharmaceutical systems disproportionately impacts disabled people that way. And so I know for my own personal experience, I have been stuck in shortages and having to call dozens of pharmacies and what if my insurance isn't taken here? And if that's monthly, that could be a monthly occurrence for people. Every month I have to go and call 10 different pharmacies to see who has my medication and who will take my insurance. And so I think that it can be a real challenge. And it's something that most people just never think about because they can just go in and get their medication super quickly because it's not something that is rare, or they don't bill as frequently. So I would say that that's something I've dealt with and have seen in my research as well.
I'll say for me, it's Cynthia Coffin speaking. My experience is the prior authorization and not getting my medication approved has been a challenge. Insurance not wanting to pay for it and having to pay for it out of pocket. It's been a huge barrier, especially if the medication's like $200 or $300 a month. And then there's also another barrier is keeping up with the amount of medication and the prior authorizations. So I've definitely had to advocate for my medic to be able to keep the insurance paying for my medications over the past few years. But it definitely having prior authorizations. I know the state of Colorado has literally stopped. They created a bill to make it to where the Medicaid is not allowed to ask for prior authorizations anymore. It's actually made the process faster for people to get their medications, which was really neat. I was actually at the working at the Capitol at the time when that bill was passed. But yeah, prior authorizations can be a huge challenge. And I've had to just keep going back to my doctors and keep going back to the pharmacist to just making sure that all things are aligned to get my medication.
Okay, well, it looks like we don't have any more questions. So I think we'll go ahead and wrap up a bit early. Thank you so much to our panelists for sharing your time, expertise, and insights with us today. And thank you to all of you for joining us for this Understanding Ableism webinar on medications and access. Before we wrap up, we would really appreciate your feedback. Your input helps us measure impact and improve future webinars. So we ask that if you have time to please complete a short post-webinar survey using the QR code on the screen, or I will also post the link in the chat very quickly. It's only a couple questions and it really does help us out. So finally, a quick reminder that today's session was recorded and will be uploaded to the Disability Empowerment Center's YouTube channel. So if you'd like to revisit the conversation or share it with others, you'll be able to access it there. And we hope that you'll be able to join us next month for our next Understanding Ableism webinar on July 21st, where we'll be discussing disability and the outdoors. So thank you to everyone for being a part of this conversation, and have a wonderful rest of your day.